Hello, my name is Dr. Alexandra Shabil with the LASIK Center Medical Group in Irvine, California. And I'm doing a series of presentations designed for people who are considering having laser vision correction, but are not quite ready to take the first step to come in for a consultation. So what I would like to tell you about today is what you would experience when you come into my office for your complimentary LASIK evaluation. What exactly is done during this testing process? Well, first of all, you should count on being with us for approximately 45 minutes. Now, if you're wearing contact lenses, it would be easier for you if you could come into the office without your contact lenses. Wear your glasses, that's perfectly fine. If you don't have glasses, and if you prefer to wear your contact lenses, you're free to do that as well. We do offer complimentary contact lens cleaning solutions and kits with the cases that you're welcome to take home with you. When you come in for your consultation, you do not need to have a driver. That's not necessary. You can drive yourself home after the consultation or back to work, of course. And what we do, first of all, is to have you fill out a series of detailed questions regarding your eye conditions, the stability of your prescription, and your family and personal history regarding eye problems. Some people that have eye conditions such as cataracts, glaucoma, or retinitis are not good candidates for the laser procedure. And we ask you in detail about these situations when you come in for your consultation. And if you do have any questions prior to coming in, please feel free to call us. My knowledgeable staff will be more than happy to answer any questions that you have before you take the trouble to come in and visit us. Once you've completed your questionnaire, we do give you a tour of the office, and we show you where the laser procedure is performed. Our series of extensive visual exams will then tell me whether or not you're a good candidate for the procedure. So what do we measure during this exam? Well, first of all, we have you take off your glasses or take out your contact lenses, and both my staff and myself will measure what your vision is without your optical correction. And this is very important because after the procedure, people are often amazed and they ask me, well, what was my vision before I had the treatment done? How bad was it? And a lot of times people have 20/400 vision. They can barely see the big letter E. They're considered legally blind if they didn't have the option of glasses, contacts, or laser vision correction. So first of all, then we measure what your vision is without your glasses and contacts, and then what your vision is with glasses and contacts. I give you a full eye exam, and I will tell you whether your prescription is stable, whether it's changed significantly since your last prescription. I will check the inside of your eye, the retina, to make sure that there's no issue with that, or with your optic nerves. I check for glaucoma. I check your color vision. And then most important of all, with the new technology, is we do an extensive 3D mapping of the surface of your eye, which is called the WaveScan wavefront analysis. And the importance of this is that with the older type of laser and the testing that we did before, and even what you're used to in your normal eye doctor's office, there is not the degree of accuracy that we can get with the WaveScan measurement. It actually is 30 times more accurate than any optical testing that you have had in the past, I promise you that. So the series of fingerprints measure how your eye adjusts in 3 dimensions. And I have an image here of one of the testing that was done. You can see the accuracy, the pinpoint measurement of the light. It measures how your eye focuses light. Every single point on the cornea is analyzed, and it will tell me exactly what type of laser procedure is best for you. I also measure the thickness of your corneas. And this is a very important measurement because it tells me whether you have enough tissue to do the laser treatment. Can we do LASIK, which is quicker healing, or do we do PRK, which takes off less tissue but has a little bit slower healing time? So once all of these measurements are performed, I will go in detail, I will tell you in detail how the laser procedure is done, whether you're a good candidate or not, and why I feel that's the case. And I will go over all the risks and complications that are possible. They're few and far between, but like any surgical procedure, there are minor risks and complications that you need to be aware of, and I will be very candid and upfront with you and let you know all all of these possible side effects. After the the exam is complete, I will then explain to you how the procedure is done in a lot of detail, and that will be the subject of our next discussion. So if you stay tuned for the next presentation, I will go in detail with you. I will tell you exactly how the procedure is done, both the LASIK and the PRK procedure is done, and we'll have a little tour of the surgical suite. So I hope to see you back soon, and if you'd like to take advantage of the free consultation, please give us a call, 949-251-0229, and one of my trustee staff will be more than happy to make that appointment for you. I hope to see you soon. Bye-bye.